Hi, everyone. Thank you so much for taking time out of your busy days to join the Splash International team for this super unique opportunity to have a global call with women leaders from Seattle, India, and Ethiopia. As we've shared throughout this week with our virtual gala, Splash brings clean water, sanitation, hygiene, and most recently, menstrual health support to kids living in urban poverty around the world. Splash is working to reach 100% coverage of all government schools in Addis, Ethiopia, and Kolkata, India. Menstrual health is a new element of Splash's programs. We're very excited to have this call today with the team from around the world to learn more about how this program has evolved, what they've seen on the ground, and what they have planned for the program moving forward. We're joined today by Emily Davis, Splash's program manager for menstrual health. She joined the team in 2019 and is based in Seattle. Next, we have Mayuri Bhattacharjee. She's the Menstrual Health Project Officer based in Kolkata, India, also joined the team last year. And last but not least, we have Belen Mojis. She's Splash's Menstrual Health Coordinator based in our Addis office, who joined the team last year. I was very honored to meet Belen earlier this year when the board made a trip to Ethiopia to visit our program on the ground. And Mayuri, I hope to see you someday too in India. With that, I'm going to turn it over to Emily, who's going to work with the team to provide an update on our menstrual health program and share a little bit about the research that they've done, the themes that they've seen. And then I'm going to ask a few questions of these amazing women leaders. So with that, I'll turn it over to Emily.
Thanks so much, Michelle, for the kind introduction. I'm really excited to be sharing more about the menstrual health research that we've done to date since the inception of the team in 2019. We've undertaken a lot of work just understanding the landscape of menstrual health in both Kolkata and Addis, and we're excited to be using these findings to shape our ultimate program design in 2021. To start, we defined a vision for the menstrual health program, and that was to create a sustainable menstrual health program that transforms the physical and social environment to empower girls so that they can manage their menstruation with dignity. This is a mouthful, but the most important piece is that we want to both change their built environment, so what they experience at schools when they use the restrooms and manage their menstruation, and also their social environment, so how their peers discuss menstrual health, how their teachers support them throughout puberty and menstruation, and how their parents perceive menstrual health and how they provide support to their daughters. Something that I like to highlight about menstrual health is just how integrated it is across, multiple sectors. This is both an opportunity for innovative solutions, engaging partners in new and exciting ways, but it also makes our work a lot more complicated. So we're addressing a lot of different components, and I like to frame them around the Sustainable Development Goals. So menstrual health does not have its own Sustainable Development Goal, but I feel it touches on, good health and well-being, quality education, gender equality, clean water and sanitation, decent work and economic growth for women and girls, and then responsible consumption and production, which is definitely that disposal and waste management component of the menstrual health stream. So now I'd like to hand it over to my colleague Belen Mojis in Addis Ababa to share more about our formative research and literature review findings in Ethiopia.
Thank you, Michelle, for the wonderful introduction, and Emily for the pleasant overview. It's also my pleasure to present the our findings. Ethiopia is a multi-sectoral approach for menstrual health program. Education, WASH, health, and women empowerment are the primary actors. There are guidelines and policies that support comprehensive and sustainable menstrual health program, which interrelate with our menstrual health program vision. When we come to our findings regarding the level of knowledge, we learned that girls have adequate knowledge about menstruation and its management once they have started menstruation. One of our interesting findings is most girls do not consider preparation for menarche as important, as they reason they perceive menstruation as a natural process. They also reported they did not see their mothers and teachers engaged in preparing them for the occurrence. Therefore, we consider late exposure to puberty and menstruation education as a critical gap, which requires a solution. When you come to the source of information, teachers and mothers reported to be major source of menstrual health information for girls. Teachers reported as a primary source than mothers. This is due to a cultural taboos around discussing menstruation among the family members. Even if teachers reported as a major source of information, Puberty and menstruation topics provided in the schools at grade 6 and 8, which makes the education as a delayed opportunity for girls. In addition to the teachers and mothers, aunts, older sisters, gender clubs, and media are reported as a source of information by the girls. When we see the personal hygiene during menstruation among schoolgirls, 9% of them took daily baths. Only 52% of the girls practice ideal menstrual hygiene. When we see access and use of menstrual products, menstruating girls have access to commercial sanitary products, both at school and at home. Girls reported they use disposable sanitary products as they have access in the market, whereas use of reusable pads and clothes were not reported by the interviewed groups. Even if girls have access to products, they did not change products as frequent as they want because they do not feel comfortable to use the school toilets. Many girls also reported they prefer to change products at home. These are the quotes from the interviewed girls. It's better to change menstrual materials at home. I never change it here. I bring 2 or 3 products with my bag, just in case, but I never change it at school. Inadequate sanitation facility is the major challenge girls face in their school to manage their menstruation. During our research, we conducted school observation among 10 government schools. We observed that schools have gender segregated toilets, but due to lack of water, most schools' toilets were unclean and unattractive to use. Many schools suffer from overuse due to a large number of students, inadequate latrine stalls, and short duration of class break time. Improper disposal of sanitary products were also observed due to lack of waste space in the toilet stalls and corridors. In Ethiopia, girls face social, religious, and physical activity restriction during menstruation. When we see social restriction, parents become more restrictive to their daughters after menarche due to fear of pregnancy and require their daughters to ask permission for any activities. Girls' interaction with their friends, especially boys, will be limited as the parents do not give them a permission. Girls also link menarche with increased household responsibilities as their parents perceive them they are mature enough to handle some tasks. In terms of religion, in Orthodox and Muslim religion, girls face restriction during menstruation. In Orthodox religion, girls are not allowed to enter to a temple and go to a holy water place during menstruation. In Muslim religion also, girls do not participate in prayers and fasting periods during menstruation. Regarding physical activity, girls do not participate in sport, playing activities, and difficult chores due to fear of heavy menstrual flow. It's all from my side. Thank you very much.
Thank you so much, Belen, for sharing the research findings from the Addis Ababa setting. I think it's really exciting to learn about that context in greater detail. And there's a lot of exciting opportunities for where our menstrual health program can really improve the experience of menstruating girls. I'm excited to hand over the presentation to our colleague, Mayuri Bhattacharjee. She's going to provide a little bit of an overview of similar findings from the Kolkata context.
Thank you so much, Emily. And just like you heard from Belen, even in India and in West Bengal, menstrual health, it spans across various sectors. There are various guidelines, policies in place. And the main sectors that we have looked at are education, WASH, health, and the women empowerment sector. And we have done our research and our literature review based on the work that is being done across these sectors. So from our findings, from our research, from our field research, and from our desk research, we've seen that the level of knowledge of menstruation of girls in Kolkata schools are quite similar to those in, to the girls in Addis Ababa. So we have found that girls who have started menstruation understand it as a bodily process responsible for reproduction. However, many do not learn about menstruation till they have their first period. The most commonly reported piece of knowledge that is related to menstruation was the importance of maintaining personal hygiene. I mean, about pads, like what to use, due to the deluge of advertisements. So a lot of girls knew that, okay, when I started menstruating, you need to use pads. But unfortunately, they do not know why it happens and what is the physiological process. And in a cross-sectional study done in Kolkata, it was found that among 200 adolescent girls of government schools, only 59% of the study subjects were not aware of menstruation before menarche. And the majority of the students reported knowing that menstruation is a biological process, but at the same time, they did not know that where is this blood coming from. So therefore, we got to know that there is definitely a critical gap for girls when it comes to knowing about their reproductive health and anatomy. So when it came to knowing about menstruation, we found that the main sources of information for girls were their mothers. And if there was a female relative or a sister, then they found quite comfortable talking about it or getting to know about what's happening to them about during this time, like what are periods? So those kind of questions they found really comfortable talking to them. And interestingly, it was quite good to also know that female teachers in schools were also seen as a very dependable source of information for girls. When we talk about menstrual health, we often talk about the lack of access to products or lack of access to sanitary napkins. But in Kolkata schools, so we found that nearly 82% of the girls that we spoke to or surveyed, they are using sanitary napkins, that is the disposable sanitary napkins. But the problem that they face is mainly disposal and maintenance. If girls are using cloth, then there is a problem of washing the cloth and finding a very good place to dry it out, because due to the taboos related to menstruation, girls found it very difficult. The girls who were using cloth, they found it really difficult to put it out in the sun and drying it. And when it came to disposable pads, in schools, even in schools, they found it quite difficult. And even in the communities, the disposal options for sanitary napkins was quite limited. And this disposal is a problem, despite that girls have access to sanitary napkins, becomes a problem because then girls tend to use the sanitary napkins for a longer period of time, and that leads to increased risks of reproductive tract infections. And when it came to supportive environment, schools, currently there is no national level initiative for a gender or menstrual health focused club within schools. So when we talk about menstrual hygiene, we also have to talk about the infrastructure that is required for a girl to manage her periods well. In Kolkata, we saw that yes, there were gender segregated toilets. And in Kolkata, compared to what we saw in Addis Ababa, the issue of water availability was not so much of a problem. So we saw that most of the schools have got however, an area of improvement that was quite evident was the lack of disposal solutions in the bathrooms. And we also heard instances, and we also saw instances where menstrual menstrual waste, if improperly disposed of, quite often led to challenges, or it caused damage to the sanitation system. For example, if a girl didn't find a waste bin, she would put the used pad and stuff it down the toilet, and it would really lead to clogging of the entire toilet system in the school. So when we did a study around the stigma and taboo around menstruation, we found that the knowledge around periods is definitely, I mean, girls who have not attended menarche, they don't really do it. And we also heard from teachers that yes, though they would like to do more classes or sessions about menstruation, but they're a bit worried about upsetting parents. For example, male teachers, we heard that male teachers were quite unwilling to discuss periods with students because they felt that it could be deemed as improper behavior. And it was quite common in schools which were co-educational or where girls and boys both studied together. The boys would be kept separate from these sessions due to the kind of, taboo around the subject. So during our research, we also found came across the social restrictions that the girls in Kolkata schools face. And some of them were quite common, and I also relate to them because one of them was the religious restriction. A girl said that they were not allowed to enter the puja room. The puja room is a place in the house where the idols are kept, and the girl said that when we are on our periods, we are forbidden to enter. And similarly, even they would be forbidden to enter places of worship or temple because they would be considered impure during this time. And in India and in West Bengal also, locally, there are dietary restrictions. Girls are forbidden from eating soft foods and pickles, etc. And there's this belief that these kind of foods will restrict menstrual flow or maybe cause overbleeding. And one of the things that it also came across from these interactions was that girls got knowledge more about the restrictions rather than on the hygiene or the knowledge part about menstruation. So definitely this is one reason that why we are doing all the work on menstrual health in Kolkata. And thank you so much. I would hand it over to Emily.
Great. Thanks so much, Mayuri, for sharing the findings from the Kolkata context. I think we learned a lot about the challenges that girls are facing in both Addis and Kolkata. And I just want to highlight why having a global team is so important to our program design process. Mayuri and Belen bring to this program, their own firsthand experiences of menstruation in these cities. And they also are able to connect with our beneficiaries on a much more personal level than I could from a Seattle vantage point. So I think that really highlights Splash's model of ensuring that our country teams are really leading the program design and program implementation process, just with support from their US-based colleagues. So thank you so much to Mayuri and Belen for your hard work in developing this menstrual health program and for sharing out your research findings.
I'm so glad we had the opportunity to hear from Splash's talented team in Ethiopia and India. And we were able to actually capture some of their thoughts and reflections on their work on the ground. We're managing lots of time zones across countries, but I'm very excited now to actually dive into some more personal questions and doing work around gender and menstrual health and issues facing women and girls, whether it's in the US or globally, is often very personal. And I think we all draw on things that come, inspirations and passions that we have from a very personal place. And so I'm going to focus some of my questions now on actually what inspires these women, these incredibly talented women leaders, to do this. What drew them to this work, why they're excited about it, what surprised them about it. And this is really personal to me as well, right? And so I'm just so excited to hear their thoughts and reflections about what inspires them to do this. My first question for all of you is, what drew you to this field? Why work in the space of menstrual health, menstrual hygiene, water sanitation hygiene, but with a focus really on women and girls? What inspires you all to do that work?
For me personally, the road to this position at Splash as the menstrual health program manager was definitely a winding one. I always imagined working in maternal health or working in kind of those health outcome focused fields within public health that really, like vaccines or those kind of areas that are a little bit more measurable. But I kind of got introduced to like the lens of social justice when I was living and working in Kenya on a diarrhea study with the London School of Hygiene and Tropical Medicine. And although the work we were doing was incredibly important, as I was getting to know my colleagues, my Kenyan colleagues, and the data collectors who were young girls at the Great Lake University of Kisumu, I learned that a lot of the challenges they faced were in their daily lives. And gender equity is such a challenge in these settings, and the hurdles that they faced to us seem like, oh, that's an easy fix. they have access to bathrooms and clean sanitary materials and things like that, but it's actually a really big hurdle for them. And I was shocked to learn that it wasn't really a focus of a lot of the larger international NGOs. We didn't see a lot of funding going towards menstrual health until about 4 or 5 years ago. And I think people have kind of woken up to the fact that girls are facing challenges in their everyday lives that boys and men do not face. So their experience of school is very different. Their experience of work and their own sexual and reproductive health is something they face, on a monthly basis, where men face it definitely not as much. So just focusing on that social justice lens and kind of incorporating gendered aspects to my work. And luckily I found this position at Splash where I could really dive fully into this kind of social justice focused work.
Thanks, Emily. And Mayuri, do you want to share a little bit more about what drew you to this field and why you're passionate about doing this type of work in India?
Well, it was mainly my own experiences with this and also facing it firsthand. Apart from it, I always wanted to work on issues of gender equality and WASH, and menstrual health was the perfect combination.
And Belen, what about you? What drew you to doing this work in Addis, Ethiopia?
It was my personal and professional experience that makes me join Splash Menstrual Health program. Professional, it was my dream to work on a program that addressed the needs of girls and women. And personally, as a girl, I attended my second level of education in one of the Addis Ababa public schools, and I faced several challenges in managing my menstruation during my stay in the school. The Splash Menstrual Health program was an opportunity for me to contribute my lion's share in addressing the end school girls to ensure that the current generation do not face the challenge that me and the girls at my age encountered before.
So this is also a field with a lot of stigma, and folks aren't necessarily comfortable speaking about issues related to sexual and reproductive health, menstrual health. Tell me, what are people's initial reactions when you talk to them about the type of work that you do? How do they react when you share what your daily work looks like?
I wish I had a better elevator pitch for when people ask me this question, and I've been trying to refine it since I've started at Splash. And I think people's initial reaction is, oh, so like you give people tampons and what does that mean? And there's always a lot of questions, and I always feel, the need to go into, well, it's a lot more than products. It's actually, girls having access to, safe and clean sanitation facilities, and stigma and cultural taboo is actually a really big issue for girls in these countries. And a lot of it focuses around menstruation. So it's more about empowering girls and not just providing them products, but addressing the cultural environment that they exist within to make it, someplace where they can be accepting of their bodies and, stay in school. So it's a longer speech than I would like it to be. Sometimes I just stick with it. I work in girls' empowerment and education because those are the things that we're looking to change. And menstruation, even in the US, it does have stigma around it. And saying that I'm the menstrual health program manager, it brings in a lot of questions, and I'm eager to address them with people. But also, for people that aren't in development, it can be a hard thing to grasp.
And Mayuri, what about you? How do folks react in Calcutta, India, when you talk about the type of work that you do and what your title is? How do folks react to that?
Well, the answer to this question is depends on who asks or with whom do I share. I have received reactions from, oh my God, that's so cool, and that's such a taboo busting title, because to find menstrual health in a designation is quite something in a country like India, which has a lot of social taboos related to the issue. At the same time, I have also received eyebrows have been raised whenever I have shared my designation.
And Belen, I'd love to hear from you too. What about your colleagues and friends and family in Ethiopia when you share about the work that you do around menstrual health? how does that resonate with folks? What kind of questions does it bring up?
When I tell people that I'm menstrual health program coordinator who works to meet the menstrual health needs of school girls, most people get surprised. I receive different reaction from different people. Some react as they are happy to know that our organization does initiate work on such unseen programs. And some react as they never heard of menstrual health program before and show the interest to learn more. But very people also laughed at me with the reaction that menstruation is a natural phenomena which doesn't require special programming.
So, Emily, one of the things that I have been thinking a lot about lately is the importance of intersectionality and how issues around health and gender are really, you have to look at the full picture, right? Where are folks living? What kind of access to economic resources do people have? You know, does someone have a disability? Are there other compounding factors that are playing in to one's experience in life and how they access different services? So what have you learned from your experience in the field about intersectionality and how to take all of that into consideration when designing a program like the one that you are working on?
So when we first started the program design process for Splash's menstrual health program, we started with, I think it was like 3 audiences that we wanted to engage. It was girls, teachers, others. And then as we began to really dive into the research and talk to a lot of other technical specialists, that list of audiences that we wanted to engage got a lot longer. It was school administration, janitors, fathers, male peers, older females, younger females who haven't reached menarche. And even now, as we begin to think a little bit outside of the school domain, we're thinking, how do we engage faith leaders who have such an impact in their community and whose voices are really strong? And how do we advocate to the right policy members within the government? And there's a lot of different stakeholders that we call it, that make up the social ecosystem around the girl. So this, idea of intersectionality is really critical. And previously, menstrual health has been put in buckets in the development space. So is it a WASH issue? Is it an education issue? Is it a gender issue? Is it a maternal health issue? An adolescent sexual reproductive health issue? There's so many different places that it fits. And what we've learned is that we have to consider all of those things. And that's why I really value Splash's approach to having a software and a hardware and even an advocacy component to our programming, because it means that we have the ability to hit on all of those different sectors and all of those different audiences. So it makes our job a lot more complicated, but it also makes it a lot more interesting. And we know that the impact we're going to have is going to be much more sustainable because we've changed everything that surrounds this issue and we've targeted all the major players. There's probably some that we'll miss, and we'll continue to iterate and adapt our program to make sure that if there is a barrier coming from one area that we hadn't fully investigated, that we can address it. And the newest one for us is including a lens of environmental responsibility. And Splash has a mandate and a mission to always be, our solutions need to be environmentally conscious. And for menstrual health, there's going to be the use of products and what happens with those disposable products after a girl uses them. So we're trying to be really thoughtful about how we incorporate a disposal component of our program. So if there is a product provision component, there has to be a complementary disposal component. So we're investigating incinerators and how do we link to municipal trash collection services to handle solid waste. So there's a lot of different things, and I swear every day I wake up to a new challenge and a new opportunity to find an innovative solution. So menstrual health definitely keeps us on our toes.
And I think you're emphasizing how important it is to be adaptable and to think about how, one component of a program or solution is going to have a ripple effect on another, and how to make sure that you are adaptable to the environment and the audiences that you're serving. One of the things that impressed me the most when we were on a trip to Addis, Ethiopia earlier this year to see the work on the ground was how much research had gone into interviewing girls, interviewing people who were going to be benefiting from this program, or were going to be, their lives were going to be impacted by it, talking to them about their what they wanted, what would make their lives better when they're menstruating, how to adapt programs to fit their needs. And some of those things were surprising for me as someone from, a US centered experience. And I'd love to just hear from you. What surprised you through that research? What were girls bringing up that were important to them as a part of the solution? And how did you incorporate that into the program?
Some of the surprises in our research definitely centered around the infrastructure itself and what girls thought of as their ideal for a toilet block. So for girls in Addis, we always imagined we're going to create stalls that are girl friendly. They'll have shelves, hooks, they'll be, they'll have access to water in the stall. They'll be able to manage their menstruation in this bathroom stall the way we do in the United States. We don't go into a menstruation room to manage our menstrual needs. So that was our goal at the beginning of the program design process. And through interviews with girls, we learned that that's not what they want. And the context is very different there. They do want separate changing rooms, and they would really love to have a shower available to them in each bathroom block. I think this has a lot to do with the girls that we're serving through these schools, and that they don't have access to a shower at home. And any woman can tell you, we want to take a shower while we're on our periods, and it's important to maintain hygiene. And a lot of the components of our hygiene curriculum are how to take care of your hygienic needs. And a lot of that has to do with washing. And so if we're promoting this and girls are saying, well, we have nowhere to do that. So they let us know that they really wanted showers. And, that makes Splash's job a lot more complicated, because if anybody knows the Addis context, we have a serious issue with access to consistent water through the municipal water services. And if there's going to be a shower in every female bathroom block, that means that our water storage needs go up a lot. So that makes things a lot more complicated. But if that's what we're hearing from the girls that they want, that's our challenge to address. And then India, as I mentioned previously, we're trialing incinerators. And this is something that if I walked into a bathroom in the United States and there was an incinerator there, I'd be really surprised. I've never used an electrical incinerator myself. So the fact that this was something that girls said they wanted, they've seen them in train stations, like, we're not the first to think of this solution. In India, there are small scale electrical incinerators in a lot of bathrooms. So I'm excited to figure out how to make that work for our program. But again, it was definitely a surprise.
Thanks so much for that, Emily. Mayuri, what about you? What surprises have you come up against throughout this research and the work that you're doing?
Well, some of the surprises would be that, contrary to belief that is there in India, there's a lot of work which is going on in rural areas on menstrual health, but comparatively, I have not seen much innovative work on menstrual health being done in the urban areas. Unfortunately, a lot of people feel that cities are fine, but I would say that the taboos and other restrictions, though of various forms in cities, are quite disempowering or can be quite limiting for the girls in the cities.
And Belen, would love to hear from you too. What kind of surprises have occurred to you throughout this work?
The surprise that I have encountered in doing this work is I found out that a lot of menstrual health interventions are undergoing in rural areas than the capital city, Addis Ababa. As Addis Ababa is a capital city, where it's thought that there are more access to variety of information, it's surprising to find that most girls, especially at primary level schools, lack adequate information about menstruation. When we conduct our formative research, it was also a surprise for me to find that some school administrators consider menstruation as it's a natural process and do not perceive its impact on the girls' education.
So Emily, you've talked about the full range of services and programs and the software, the behavior change work, the empowerment work, the hardware, finding construction managers to build toilets and services for young people to access. But then there's also the product side of this, and managing one's menstruation requires products, and there's a variety of products, as we know. And I have memories of traveling in other countries and going to pharmacies and grocery stores and trying to find menstrual health products and not being able to, and talking to, I remember very uncomfortable conversations with male pharmacists and asking them where I could find tampons and them staring at me blankly. And I know that this must be a huge challenge for women and girls around the world, especially when you add on layers of affordability and sustainability and access, and if folks are removed from stores that might sell those types of products. So that's a huge component of menstrual health and managing it. What has Splash thought of in terms of the product side of this, and how we're going to ensure access to products?
That's a great question, and one I'm always really eager to address, because Splash is, this hardware infrastructure side of things, and then, as you mentioned, behavior change. And that is not by any accident. We were intentional in not including provision of products just because we are trying to reach scale in these cities. And we found that, donating products can be damaging to the local markets. And providing products to schools to give to students is not exactly the most sustainable intervention approach. So our mission is to provide as much information about the types of products that are available to girls, and then support teachers and parents to be able to guide their children in accessing these products at local markets. It is a challenge to find menstrual health products. I've also experienced that myself, and when you do finally find them, they sell them to you and put them in a black plastic bag so no one can see the label, and it's very secretive, which is, for a woman who menstruates every month, it's just like, what's all this about? Not necessary. But yeah, so we have decided to stay away from products. We want to make sure that girls that are using reusables know how to maintain the reusables, wash them and dry them in a hygienic way. And then for girls that use disposables, what types of markets and things like that they can access them at. But that's kind of the extent of our current work. We are trialing a pad vending machine in Ethiopia, which is really exciting. This, again, is one of those requests from the students. But this pad vending machine is not meant to be what they go to every month for every sanitary product need. It's kind of an emergency stock vending machine for the girls that, maybe got their period a little earlier this month, or forgot a product at home, or maybe this month they don't have money to buy a product. So we think of an emergency stock pad vending machine as a little bit more sustainable, and we're going to definitely provide guidance to the school administrators on how to host, pad drives at their schools on event days, so that students and parents know, okay, this is the day we donate a box of sanitary materials to the school for girls in emergency situations. So that's the extent of our product side of work.
Why is it so important that Splash be working with both boys and girls on these topics? Why is it important that we're raising awareness about gender issues, not just with women and girls, but also with young boys, with their peers in school?
Teasing is something that has come through in all of the data that we have collected, that girls are afraid of their male peers finding out that they are menstruating, or seeing a menstrual leak or stain on their outfit, and being afraid of being teased. I think that resonates with every young adolescent across the world. But in these contexts, when they're afraid of that teasing, but they don't have the knowledge or access to the solutions, it's kind of like this hopeless situation. But one thing that we really want to do is make that fear of teasing go away. And when that fear of teasing goes away, then there can be more room for questions. And for boys, they also need to understand menstruation, because these boys will grow up to be, male partners to women, fathers to young girls. And this is the kind of pathway of changing social norms, especially in somewhat more patriarchal societies, targeting boys as norm shifters and change makers and advocates, I think that's the most powerful thing we can do right now, to create an environment where girls can be fully empowered to achieve their potential.
What about you, Mayuri? What do you think about the importance of including boys and men in these conversations when you're doing this type of work in India?
Splash's overall hygiene program is quite inclusive and includes both boys and girls. The child cabinets that are formed in Kolkata schools have got equal representation when it comes in schools which have both boys and girls. And when it comes to menstrual health, yes, we are trying, but due to the kind of social taboos, there has been a pushback from a lot of schools to include boys in menstrual health sessions or in the child cabinet. When we want to do a menstrual health session, there has been a kind of hesitation that we have faced, and that's a challenge. But going forward, with a separate menstrual health program in place, we are looking at male audiences or male students as an important part, and we have a couple of things planned. So yes, stay tuned for that.
And Belen, I'd love to hear from you as well with the context in Ethiopia. How do Splash's programs incorporate boys as well into these conversations?
The Splash Hygiene program includes both boys and girls, as both are the major influencers for the school hygiene program. Similarly, in our existing menstrual health program, both boys and girls are targeted, because we think that in a male-controlled society like us, targeting only girls like clapping with one hand. For the greater success of our program, we need to involve boys to address cultural and social taboos and to create a supportive school environment. We have seen good improvement in involving boys. We are also working in including boys in our new menstrual health program.
Michelle, when I first started at Splash and I was building relationships with fellow menstrual health advocates in Seattle, one of the first names that was on the list of people I should meet was yours. Just based off of what you've seen of Splash's work and obviously your history working in the gender equity sector, what are your hopes for the future for these girls, and where do you see this menstrual health program making the biggest impact?
I hope that we can start normalizing some of these conversations, right? And that they don't have to feel off to the side, right? That having conversations about menstruation or gender or sexuality or identity have to be something that happen, in a box separate from these other dialogues around access to water, access to public health services. I think incorporating these conversations is going to get us, farther, faster. And I hope that we can continue to see young women be recognized as leaders in their community, not just as beneficiaries of or clients, but actually that they should be driving programs, should be leading cabinets, should be in positions that are elected. And I just see so much potential in not just the public health component, but really the leadership component. And if we're shifting public, this is generational change here. That's why I think it's so critical that when we're talking about issues of whether it's gender-based violence or gender health, that we're incorporating boys and men in that conversation, because we know that it's going to take time. And I hope to see a young person that Splash is working with in an elected office in a few years, or leading a school. One of the most powerful conversations I had in Ethiopia earlier this year was actually one of the headmasters of one of the schools of a girls' school. And she was just showing me around and talking about how their approach to education centers the experiences of girls in their community. And I think that is where we're going to see so much progress in regards to gender equity. So Emily, I'd be remiss to not ask you how our programming at Splash, this program in particular focused on menstrual health, has been impacted by COVID-19 crisis and the related effects that we know ripple out from this crisis, right? It's a public health crisis, it's an economic crisis. So talk to me about how COVID has shifted your work, has shifted Splash's work around menstrual health.
So COVID has, for lack of a better framing, has really thrown a wrench in our program design process. We originally were going to host a menstrual health strategy summit, bringing together technical experts, government stakeholders, as well as other local implementers to really refine our strategy for both Kolkata and Addis. And this was meant to happen in March, right when the COVID crisis was really hitting everyone in a really serious way. And we made the decision to postpone the summit, or kind of rework our approach to accommodate a virtual summit instead. So we had a session with all of the attendees where we shared out our research findings and started to ideate around pilot ideas. The pilots are complete. We have them in concept notes ready to go, but we can't do the pilots until schools are open. So right now, the menstrual health team at Splash is really focusing on developing creative briefs to make sure that the messaging and the channels that we want to use for each pilot are really refined for when we engage external creative agencies in the materials development. We are trying to document our program design process a lot more closely than we would have if COVID had never happened. So we're looking at this as an opportunity to put together a package of materials for the program design side to share with other implementers, to share what our thinking has been and what steps we've taken to make sure that, as I mentioned, all of the audiences and stakeholders that are a part of menstrual health, how we've engaged them, so that other organizations can emulate the Splash process. So we've found the silver lining in it, but it has been really challenging not to be able to go into schools and do the pilots the way we had originally designed. It's also delayed our timeline of when the final program approach for each context is going to be completed. So yeah, along with everyone in the world right now, the menstrual health team is just working on pivoting in a way that we find the most useful, but also just accepting that things aren't going to be the way we had originally imagined.
And I do know that Splash has adapted some of their work. I know that a lot of their work is in, a lot of our work is in schools, but talk to me about broadly how Splash has adapted to the COVID crisis and been able to help in some ways.
I'm incredibly proud of being a part of an organization like Splash, where we saw a gap and an opportunity to help, and we jumped in. So Splash is known for our water and sanitation work. We have amazing hand washing stations that were designed through a human-centered approach, and we have, historically used them in schools. But now with the COVID crisis and the need for increased hand washing, especially in healthcare facilities, we have been building hand washing stations and providing filtered water at hospitals, community centers, quarantine centers, and any place where there's that need. So yeah, the work has changed. We're not in schools right now because they're not open, but we are definitely still very busy on the ground. Our teams are busier than ever, making sure that we can support this COVID solution or COVID support in any way we can.
Thanks so much for that. I am also proud to be on the board of an organization that is pivoting and being adaptive, during these times. I think it's important that we all look for creative and innovative ways to be seeking out solutions that can help communities. Thank you so much, Emily, Belen, and Mayuri, for joining us today, for sharing about this incredible program at Splash and the work that you all have done over the past year to develop, strengthen, and grow the menstrual health program. I am so proud to be affiliated with an organization that is doing this work, that's centering women and girls, that's focusing on women's empowerment through the lens of water, sanitation, and hygiene. So I'm giving you a virtual round of applause, as I know many are. And I just wanted to close it out by thanking you all for tuning in and for spending this time with us today. We are living in very uncertain times, but I'm also certain that we're all going to get through this together as a community, as a country, and a world. This is an opportunity for our community to come together and support nonprofits, working locally, working globally. And we know that many of you have already done your part and have donated to amazing nonprofits that are working directly to support communities affected by COVID-19. And we want you to continue to do that. We thank you for tuning in today, for caring about this issue of menstrual health, for caring about gender equality, whether it's here in the US or around the world, wherever you may be. And we're also thankful for your support of our work, and also your support for these incredible nonprofits that are working to address the COVID-19 crisis. So we're so encouraged by your generosity, but we also know that the needs around us are growing. So in these unprecedented times, as you are likely supporting your families and communities in remarkable and very generous ways, whatever more you can give to Splash, we're very appreciative. Thank you so much for tuning in, for spending time with us, and we hope you all continue to stay safe and healthy. Thanks, everyone.